Welcome to the Global Surgical Training Challenge Discovery Awards ceremony. I'm Catherine Moore, President of the Intuitive Foundation, and we are thrilled that you have joined us today to recognize and celebrate the teams who are receiving the first awards in our challenge program. This challenge is aimed at creating universal access to training and assessment of psychomotor skills involved in surgery so that surgical practitioners will be able to master a new skill from anywhere in the world at any point in their career. As the sponsor of this challenge, the Intuitive Foundation hopes to build an enduring legacy of training materials that will help us address the global shortage of surgeons and to help the billions of people who today die or live with profound disability because of lack of access to surgical care. Before we get into our event today, I first want to thank our partners, Nesta Challenges, MIT Solve, and Apropedia. This is a team that has demonstrated resourcefulness, resilience, and cooperativeness despite our far-flung locations in a year of uncertainty and change. I also want to sincerely thank our global panel of judges who never got to meet in person, but who selflessly gave of their time working from so many different countries and each bringing their unique experience to the formidable task of choosing between so many excellent proposals. We'll introduce them to you later in the program, and I hope that at some point in the future we will all get to have that long overdue dinner together. Launching a global challenge in the middle of a pandemic presented some very interesting challenges. It also demonstrated how motivated innovators are able to solve significant problems in global surgical training. As a potential silver lining, we also saw that when forced online and virtual, some potential new opportunities for multinational teams to form opened up. We were thrilled to have so many individuals and teams participate in our online events, and our partners, MIT Solve, rose to the occasion to adapt their traditionally in-person solve-a-thons into something that could be done virtually. The quality and caliber of the applications for the Discovery Awards was impressive, and I want to thank everyone who took the time to submit an application. And I also want to thank all of you for joining us here today. In this new world of online global events, we're all learning as we go. During our hour event today, we'll have a short keynote presentation from Professor Abebe Bekele, University of Global Health Equity, on the future of surgical training. We will then hear more on how the challenge applications were assessed and speak with a number of the challenge judging panel before the announcement of the 10 Discovery Award winners, before closing with 2 exciting announcements as we look to the stage of this next stage of the challenge. And you can follow the event and the discussion surrounding it using our event hashtag GSTC Awards. So it is now my distinct pleasure to introduce our keynote speaker, Dr. Abebe Bekele. I first met Professor Bekele over a year ago in Kampala, Uganda, which now seems like a remote and different world, and I'm amazed that it's only been a year since then. I was in Uganda as an observer at COSEXA's fellowship examinations, where Dr. Bekele has just returned from now. COSEXA is the College of Surgeons of East, Central, and Southern Africa, and these exams, which were being directly overseen by Professor Bekele in his capacity as the chair of the Examinations and Credentials Committee, were a model of multinational cooperation, high, consistent standards for surgical education, and it was a testament to the dedication of the surgical educators who seek to raise this next generation of surgeons. So who better to address us about the educational needs in global surgery? Dr. Bekele is a founding dean of health sciences in the University of Global Health Equity, and he is a general and thoracic surgeon and professor of surgery at Addis Ababa University in Ethiopia, as well as being a fellow of both COSEXA and the American College of Surgeons. He has fellowships from the American College of Surgeons, the University of Washington, and the Foundation of Advancement of International Medical Education and Research. Dr. Abebe is the deserved recipient of multiple regional and international awards and recognitions. Ladies and gentlemen, Professor Abebe Bekele, thank you so much.
Thank you very much, Catherine, for the very kind introduction. Ladies and gentlemen, good morning, good afternoon. Thank you very much for inviting me, giving me this opportunity to address this great team um, about the future of surgical education in the world, particularly in the East, Central and Southern African region, in relations to this new grant award we are today announcing. Thank you very much for inviting me to be your keynote speaker. I have a few slides to share with you. I hope the first slide will show now. The next slide will show you the fact that things have changed in medical education and in surgical education, to be precise. There is data out there at the moment that the dire shortage of the surgical workforce is clearly out there for the world to see. What we have now, fast forward 10 years, the shortage of surgical workforce will probably double. The population of Africa is increasing in number, and the population is asking for specialized, highly skilled and qualified health care. It's not like 20, 30 years ago where a general practitioner or a general surgeon can take care of most of the diseases. The disease patterns are changing significantly, and highly skilled, highly specialized care is deserved and requested by the African population. Fortunately or unfortunately, the issues of task shifting and task sharing are increasingly happening in Africa because of the global shortage of surgical workforce. And as I have said again, the population is requesting for evidence-based and value-based healthcare. So this means, as the next slide will show you, that the way we train surgical providers, surgical care workers, should also change gradually. So this is where the Global Surgical Training Challenge comes in. I'm very happy to see that we have the series of applications, ideas were submitted for consideration, and very impressive ideas are now being nominated and awarded this surgical challenge grant. The main focus of this grant is to create a multidisciplinary but LMIC-led teams that hopefully will end up creating an open source surgical training modules that relate to skill, psychomotor skill for the surgical workforce. And this hopefully will also create a new platform to assess the training modules which are accessible to all. The next slide then shows you the fact that more than 250 participants were there during the Solvathon, from which 41 applications were received from 44 different countries. Wide variety of applicants, surgical practitioners, educators, technologists participated in the application. The bad thing about competitions is that only limited number of awards will be given. I would have been very happy if all 250 were awarded, because this would have contributed enormously to surgical education in the world. But as the next slide shows you, only 10 from these more than 250 will be awarded today. So I would also like to take this opportunity to thank all the members of the judging panel, participants of the Challenges online events, and all the applicants for taking your time to write your grant, submitting and competing in this application. As a conclusion, as the next slide shows you, our expectation, my own personal expectation as a surgeon working in a low and middle income country, as education's chair, examinations chair of COSEXA, my expectation is to see a sustainable, innovative and easily integratable training modules that contribute to the development and improvement of surgical education and the improvement of the surgical workforce, particularly in this part of the world. Let me conclude my remark here and conclude by thanking all of you for listening to me and for the very kind invitation. Thank you very much.
Thank you, Professor Bekele, for that address. I am so proud that we share such a vision for the future, and thank you also for your service towards this next generation of surgical educators. I'd like to now hand this over to Caroline Purslow. She's the Global Health Program Manager at Nesta Challenges, who's been guiding this challenge process. She will share with you insights into the work done so far and the assessments process that was undertaken to choose today's Discovery Award winners. Caroline.
Yes, so I'm delighted to be joining you from London. Our team at Nesta Challenges has been working with Catherine and with the Intuitive Foundation since January last year. As you can imagine, it's been a challenge, but also a delight to bring this programme to life during what can only be described as an extremely trying 2020. We launched the challenge in July with our partners MIT Solve, and we began with a series of hackathon-style online events called Solvathons. Bring together surgical practitioners, educators, technologists from all around the world, or the multidisciplinary teams needed to make the creation of these surgical training. We were nervous, of course, about bringing what are normally in-person collaborative events to an online space, but MIT Solve's design of these workshops ensured that participants were able to ideate together and supported the team development across country lines. So from these 10 global events, we worked with the participants to help them develop their applications for the Discovery Awards. And these submissions closed last November. Applicants were asked not only to lay out their plans for the development of novel surgical training modules, but also the plans for the creation of the self-assessment frameworks to allow these modules to be used independently of a classroom setting. Ultimately, this challenge aims to populate an online community with these created modules, giving access to all surgical educators and practitioners globally. And we'll hear more from Acropedia, our partners who are building this platform, later in the event. So to the Discovery Awards themselves. We received 41 applications, down from those 250 participants in the Solvathons. And these were from teams spanning an incredible 44 countries, all of whom have a team lead in a lower and middle income country, as per our entry requirements for the challenge. The 41 applications were shortlisted by a panel of expert reviewers before our judging panel met to decide which of these shortlisted teams would receive up to $200,000 to develop their surgical training module. So we're now going to hear from some of those judging panel members in quite a short panel session. And hosting that panel, and to introduce you to our judging panel members, is Patrick Diamond. Patrick is the Manager of Strategic Partnerships at MIT Solve, and we've been working together on the challenge for just over a year now. So thanks very much, Patrick, and over to you.
Likewise, thank you, Caroline, and I'm delighted to be here today with you all to celebrate this milestone. I'm actually going to it's been a pleasure, of course, to partner with Nesta Challenges and Intuitive Foundation on this project. Truly, the innovators who participated in the workshops that Caroline mentioned were engaged and inspiring. We learned a lot from each other through what could have been a pretty complex process. We worked together to really further the development of the next generation of surgical practitioners in low to middle income countries. So today I'm delighted to bring together and to share some space with 4 experts in the field of surgical training for a short discussion about this challenge and what we saw along the way. These 4 individuals are part of the 13-person strong judging panel that evaluated each of the applications for the Discovery Awards. I'd like to welcome Sir Murray Brennan, who is the Senior Vice President for International Programs at Memorial Sloan Kettering Cancer Center in New York in the United States. As well, Dr. Charles Uma, who is a medical doctor and surgical trainee at Edinburgh University in the United Kingdom. Joining us as well will be Professor Martin Smith, who is Professor of Surgery at Wits University in South Africa. And lastly, Dr. Monali Mohan is a comprehensive emergency obstetrics and neonatal care mentor in health system strengthening at CARE India. So I welcome each of these panelists to the screen, and they'll join us in a moment. All right, welcome back, everyone. So as I said, we're joined by several of the judges from this panel, and I'm just going to ask a few questions to give you all a better sense of what we saw with the entries to the challenge. So I'd like to start with you, Murray Brennan. Now that we've reviewed all of the entries, what personally excited you most about what you saw with this challenge, or maybe with particular applications that you reviewed?
Well, the most impressive initially was the quality of the application process, and particularly the evaluation process. I very much liked the idea of the combination of the low middle income countries with a high income advisor or overseer. I particularly liked the idea that many of the applications were applicable not only to the country of origin, but to other parts of the low and middle income countries. I looked very hard and enjoyed at least the awareness that they wanted sustainability. We haven't proved that they have sustainability, but we were certainly looking for it. So I think the process is great. I think the selection has been great. And now we look to see that they can sustain the process. Thank you.
Of course, thank you for that. I would love to ask Manali a question about one aspect that Caroline mentioned earlier that's really key to this challenge, which is self-assessment. So the challenge requires that each of the modules that we'll announce in a moment really center self-assessment in their training approach. So Manali, I would love to hear how that approach of self-assessment differs from more traditional or ordinary approaches to training surgeons.
Thanks, Patrick. First of all, I was super excited to read all the proposals. I think it was a great learning opportunity for me as well. In terms of constraints on the field level, let's say at a district hospital, there is usually no luxury of having an academic environment, so to speak, like you have in medical colleges or at hospitals, which are probably placed in a more resourced environment. So the surgeon who's there is usually the only surgeon. The team that is there is usually consists of very less number of people, and there is, of course, lack of resources. So traditional way of teaching where there is a tutor and there's a mentee, those kind of environments and interactions are usually not possible. So self-assessment process gives access to the candidates to observe how they are performing while they're on the surgical simulator, and then monitor their own progress. And eventually this progress can be transferred to the actual live scenarios where they and their teams can finally help improving the performance for those specific processes or techniques at their respective hospitals. So I think this self-assessment technique where you can monitor your own progress is extremely essential in a place where there is a lack of an academic environment and where there's lack of peer interactions, a lack of a tutor or a mentor. So in that environment, I think it's going to be a very sustainable way of assessing your own progress. Thank you.
Definitely. Of course. Thank you for that. And we built in the self-assessment framework into the application so that we can reach more potential learners across the board as well. So that's one thing that we're looking forward to seeing the teams incorporate into their modules.
Right.
Professor Martin Smith, I would love to ask you, we will shortly learn who the recipients of the Discovery Awards are. What's a message, your message to the winners who have not been selected for this occasion? It's always challenging that, with these types of competitions that some people don't move forward, but would love to hear, words of encouragement or advice to those who will continue on, but not win this award.
Thank you, Patrick. So I guess the whole philosophy of the process has been well outlined by others who have spoken before me. And so I guess all of us working as surgical educators and as surgical deliverers of service, should always keep in mind the kind of messages that came across. And so even if you haven't had the opportunity to win or to be nominated here, I think it's the recognition that the work that all of you are doing remain important and remain really valuable for training, even if it's not going to be expressed through what the challenge is going to outline. Because I think that this is a collective and all of us need to contribute to this process. I would imagine that there would be other opportunities where you've developed your approach a little bit more, and you may be able to, again, try and, become a winner in this area. But I think based on the quality of all the submissions, all of you are winners. All of you have really demonstrated that your contribution, your desire to see improved access to surgical care through improving skills, that you all have that commitment. And I would urge you to continue to build on what you've developed so far and to use that in whatever area you're working, but also to look out for other opportunities where you'll be able to contribute to this endeavor. So thank you, Patrick. I think that hopefully will be some incentive to those who may not have been awarded a prize here today.
Thank you, Martin. So I have one last question. I'm not sure who to direct this to, but Caroline mentioned that we're building multidisciplinary teams. We did that through our workshops, throughout the application process. And the teams that we'll announce shortly are truly multidisciplinary. There's a clinician, there is a educator, there's a technologist, and in many cases, many more. Why is that important when thinking about training the next generation of surgical practitioners? Maybe Murray or Martin, you might have a perspective on that.
So I think the important thing about surgery is that it's about the team. And one of the important skills that we have to build in surgery is the team. And so I think this is really an opportunity to, realize that objective by bringing together different skills with a common objective. And so that's why I think it's really important, because we're surgeons, we have certain skills that we can add to this, but educators and people with, extreme skills in technology, really bringing that together is a remarkable force to address that teamwork and the system that's required to deliver surgical care.
I would agree with Martin in that it is a team. The surgeon often sees themselves as the leader of that team, but if you're the stroke in an 8, you're only as strong as the 8 members of your team. And so this is an opportunity not only for surgeons to lead, but an opportunity to strengthen their team, where everybody benefits from such an approach. Surgery is very much a team sport.
Definitely. Well, I want to thank you again, each of you, for spending some time with us. And I'll actually turn it back over to Caroline, who I believe will let us know who the winners are.
And now, as they say, the moment we've all been waiting for, the announcement of the recipients of these Discovery Awards. Each team has been awarded grants of up to $200,000 to develop a prototype of their solution, and we will get our first look at these solutions in August of this year. And as you've heard, the judging panel selected these 10 teams from a highly competitive field. Each team needed clinical experts, educators, and technical excellence, and the expertise represented in these applicants was both deep and broad. Selecting only 10 was not an easy task, but we're excited by the results. And the finalist projects span surgical specialties, including orthopedics, pediatrics, cardiothoracics, gynecology, and trauma surgery. The team represent contributors from Africa, South, North, and Central America, as well as Europe. It's my sincere privilege to introduce you to the recipients of the Discovery Awards.
We are designing a surgical model for medical officers and general surgeons who have not had a formal training in pediatric surgery to enable them perform a safe colostomy in a newborn. Our Discovery Award will help us to collect data to validate that our low-cost West-Great model is effective in training. With this training tool, we hope to teach gentle tissue handling skills that are transferable to the performance of other life-saving surgeries.
We are developing Open SurgiSim, which is the world's first surgical training module for orthopedic surgeons to get trained or to become expert in performing accurate bone deformity correction. Our Discovery Award will not only help us to build this product, but also to clinically test it at various low resource settings.
We hope to achieve the development of an educational web and mobile-based app that is integrated with a low-cost physical model to train users in hemorrhage control. The most important lesson for us in this process was learning that pre-hospital staff in Guatemala-like training in hemorrhage control and very much want this training. It is amazing to see how simple skills, even thought virtually, can save lives.
Our Discovery Award will help us validate that our open source 3D bone simulation models provide high low-cost orthopedic skills training. One of the big lessons I learned in this process was the building of an international multidisciplinary, inclusive, and collaborative team.
We're designing a surgical model for gynecology and general surgery trainees, as well as medical officers, on performing safe ligation of uterine vessels and closure of the vaginal cuff as part of the open abdominal hysterectomy. Our Discovery Award will help us bring together a team of intellectual and well-experienced surgeons and technical experts to achieve the development of an innovative surgical training platform in low-middle income countries.
Once we have achieved this surgical training module and we are able to deliver it to surgeons, definitely there is going to be a huge impact for the whole population in the world.
We are designing a surgical model for both general and plastic surgeons on restoring form, function, and feeling through local flap surgery for patients with wounds and defects due to burns, trauma, cancer, and congenital conditions. Our Discovery Board will support the creation of a unique mixed methods approach to surgical training that will use a simulation platform incorporating virtual learning modules and simulations, along with a low-cost and adaptable psychomotor skill training system.
We are designing a surgical model for medical students, medical officers, and general surgeons, and other non-orthopedic practitioners to develop their skills necessary to help drill bone and place fixation pins into bone. Being able to drill bone is a critical skill that we find very useful in our setting, especially with bone infections.
We're designing a surgical model aimed at surgical trainees and general surgeons in the developing world for the repair of simple congenital heart defects, like the patent ductus arteriosus, or the PDA. Our Discovery Award will help us to develop an innovative simulator utilizing a hyper-realistic, tissue-like physical model with built-in sensors paired with augmented reality.
We work together to collaborate to improve the access to and delivery of healthcare. And we're designing a surgical model for the doctors expected to perform open appendectomies at primary and secondary health facilities throughout the world.
Hi everyone. So that was the 10 winners of the Global Surgical Training Challenges Discovery Awards. So what can we expect next for the teams and for the challenge itself? Well, one key aspect of the challenge has been the creation of this online platform to host the surgical training modules. And for this, we've partnered with Acropedia. To tell you a little bit more about the platform and about Acropedia itself, we're now going to show you a short video from Emilio Veliz, who's the Executive Director of the Acropedia Foundation. So without further ado, over to Emilio.
Hi, I'm Emilio Veliz, Executive Director of the Acropedia Foundation. I want to briefly show you the portal and tools that we have prepared for the Global Surgical Training Challenge. Acropedia helps experts document their research and innovative solutions connected to sustainability and international development. We provide the tools so you can teach others how to perform a procedure, build something, or even run a project. With this in mind, we created a portal for the Global Surgical Training Challenge. It contains validated training modules ready to be used in various settings, especially for simulation-based surgical training to prepare medical practitioners in low and middle-income countries at a low cost. These modules are composed of skill pages with annotated video tutorials and knowledge pages with instructional content. You can describe each skill with its requirements, show others how to do it, and explain how to self-assess their performance. We will also provide you with a toolbox of ideas and resources to help you communicate practical knowledge effectively as you develop your own training modules. One example is the National Registry of Emergency Medical Technician skill set, a module with a complete set of psychomotor skills required by the state of California for registration as an emergency medical technician. It will allow anyone to learn, practice, and self-assess these skills remotely. This is the bulk of what we have prepared for you on Appropedia. We invite you to come and explore a topic that interests you. Think of Appropedia as a part of your team's toolkit and start navigating your way through skill pages such as the one already existing at the Global Surgical Training Challenge portal. We're excited to be part of this competition and support your work as you create practical open source knowledge available for medical practitioners worldwide.
Thanks, Adrian. So another key aspect of the challenge has been to ensure that these 10 Discovery Award-winning teams will be supported both by subject and technical experts throughout their module development period. And to that end, today I'm delighted to announce that the challenge has partnered with the Royal College of Surgeons in Ireland. They will lead this mentorship programme for the winning teams. So to hear more about the Royal College's work and to tell us about how the teams will be supported during their mentorship period, I'm pleased to introduce you to Eric O'Flynn. Eric is the Programme Director for Education, Training and Advocacy at the Royal College's Institute of Global Surgery, and it's been a pleasure to work with him over the last few months. Over to you, Eric.
Thanks, Caroline. And hello from Dublin, Ireland. First of all, let me add my congratulations to the winning teams. These clearly are projects that have the potential to make a significant difference in the lives of patients requiring surgery around the world. We in the Royal College of Surgeons in Ireland are delighted to be coming on board as part of this challenge. And indeed, it is a privilege to work on such an innovative program and with such high caliber teams. In RCSI, we've long recognized the need to act on the lack of access to safe surgical care for much of the world's population. And I've for many years supported partner organizations in surgical and anesthesia training and practice in low resource contexts, particularly in East, Central, and Southern Africa. Over the next 2 years, RCSI will be leading a mentorship program for teams, first in the discovery phase and then in the finalist phase. We'll do so in close collaboration with the other organizations involved in this challenge, and indeed with many others around the world. Mentorship is a proven strategy for the development of projects and people. We see this mentorship program not as something prescriptive, but indeed as a resource for teams to draw on, to help teams work through problems and answer questions that they may have or that may arise, or simply to discuss and get other points of view on certain aspects of their projects. This program aims to foster a strong relationship between each team and their individual designated mentorship manager, as well as to provide the teams with structured access to a wide pool of expertise and experience in specific areas related to this challenge. RCSI is both a surgical training college and a University of Medicine and Health Sciences, with campuses in Ireland, Malaysia, Dubai, and Bahrain. And we see this mentorship program as a cross-college initiative involving the RCSI Institute of Global Surgery, Faculty of Simulation, Department of Surgical Affairs, and many others, as well as experts from around the world in both high and low resource contexts. This broad involvement is intended to bring diverse experience and diverse opinions. Indeed, vitally important is that this program also creates opportunities for teams to interact with and learn from each other, building a community of practice. We recognize that the leading experts in this area are indeed the members of the teams awarded today with Discovery Prizes. We'll be in touch with the teams in the coming days with more information, and we greatly look forward to supporting them in their hugely important work. It's really very exciting. So congratulations once again to the successful teams.
Of course, I knew I would not mute at one point. Thank you so much, Eric, for taking on this challenge and being ready to support the teams. We're really looking forward to how this all unfolds. So this concludes our awards ceremony for the Global Surgical Training Challenge. And once again, I want to thank each one of our partners, Nesta Challenges, MIT Solve, Apropedia, and now the Royal College of Surgeons, Ireland. And a big thank you to our judging panel for their time and their commitment. And I want to thank each of you for joining us today from all over the world. And a big thank you and a congratulations to all of our Discovery Award recipients. We look forward to the months ahead and are excited to see what comes out of this. If you would like to follow the progress of our program, we encourage you to stay in touch via our social media channels on Twitter and LinkedIn. And let's see how this unfolds. Thank you very much.